My name is Bruce Yaffe. I'm a board-certified digestive disease specialist, as well as being a concierge primary care physician. Been in New York for about 35 years. I'm affiliated with NYU and Lenox Hill, and I was trained at Mount Sinai Hospital in New York. I like to listen to the whole story. I want to appreciate the personal situation that each individual is going through because each individual has a unique situation. In this practice, it's you, the patient, and me versus it, the problem. You and me versus it is very important, and it's a different way to practice medicine. We're in it together. We're trying to figure out what's what, problem solve, and address the issue as it pertains to you. The in-office endoscopy suite we've been using here for over 20 years, and Medical Offices of Manhattan has provided us with the most efficient equipment. We have an excellent senior anesthesiologist. It's all done in-house. We even give you a little treat on your way out. It's a very pleasant and very comfortable experience. An endoscopy is looking into the esophagus, the stomach, and the first part of the intestinal tract, the duodenum, with an instrument that enables us to evaluate whether you have GERD, whether you have stomach ulcers, stomach cancer, duodenal ulcers, or just gastritis. We look for H. pylori, which is a bacterial infection. We do endoscopies on people who have upper digestive tract complaints, indigestion, heartburn, ulcer types of pains, or people where they feel full too easily. It's called early satiety. Those are the people who get endoscopies. For the endoscopy, you miss no meals whatsoever. It's just no food or water after midnight. We have a great staff, and we try to make endoscopy and colonoscopy as patient-friendly as possible. You're asleep with a senior anesthesiologist watching over you for 10 to 15 minutes, and you can often expect to leave the office within 2 hours after you walk in the door. Fully awake, fully able to go back to work, though you can't drive a car for 3 hours after anesthesia by law. The endoscopy is pretty much a risk-free procedure. Occasionally, if there's a lot of fluid in the stomach, one can suck some of that fluid back into the lungs while one is laying there asleep. That rarely happens, but that is the major risk. Once you wake up, you basically ask the anesthesiologist if he's willing to come to your house because you've had such a pleasant experience, but you're able to get up and go within 10 or 15 minutes. When we do the endoscopy, we're actually looking at the inner lining of the esophagus, the stomach, and the duodenum. So we can see immediately what we're looking at and see if anything looks abnormal. If something looks abnormal, we take a little piece of tissue, biopsy, and look at it under the microscope and usually get the results back in a couple of days. If we see something that looks suspicious, could be an ulcer, it could be some kind of polyp, it could be a stomach cancer, but usually we have a pretty good idea just by looking. I enjoy being a GI doc. It gives me an opportunity to treat the whole person. And I do about 30 procedures per week, and I've been doing this for about 40 years. That's a lot of procedures. I've prevented a lot of colon cancer in a lot of New Yorkers, and I intend to do this for at least another 10 years. I'm very proud of the fact that I've been affiliated with the American Cancer Society and have been a media spokesman for them over the years.